Good morning, welcome back to Morning at NTV. My name is Malaki Vilodera. Now today on the Kickstarter segment, let's talk about health. And so today the focus will be on preventive healthcare, how we can prevent ourselves from getting diseases that we can actually avoid. And so in studios to talk about that is Mr. Dan Kimosho. He is the spokesperson at the National Medical Stores. Welcome to the show.
Thank you. Thank you.
You're welcome. Good morning. Let me start by congratulating you guys. You are getting to the 25th year mark.
Yes.
Tell us more about that.
Oh, thank you very much. Good morning, viewers. National Medical Stores, of course, is making 25 years in service, and that means we started in 1993. We are now in 2018, and we have since served Ugandans, giving them medicines, of course, and medical supplies to over now 3,850-something health facilities across the country. And in every citizen's life, at least we play a role on a daily, because we serve up to the parish level. If you know the local government structures, that is the lowest at the village level. At every village level, there is a health center too, and National Medical Stores takes medicines from Entebbe on a daily to those health facilities, and then up to Mulago, which is the referral, the National Referral Hospital. And once in a while we call it the Supreme Court of Medicine in this country.
Let me ask you a question. Let me start firing shots. Then how do you explain drug stockouts in public health centers?
Yes, of course it's a range of things, and one major and very critical issue to explain that is the prevention aspect that we'll be discussing. We have been at it for the last 25 years, and we are the best, I would say, confidently, by the way. And we have realized that one major thing that, or challenge that we need to solve, is the issue of people going to health centers in this country. Because we have realized over time that 75% of diseases that take us, Ugandans, to health centers are preventable. Unfortunately, as a country, we have not concentrated on prevention. So literally meaning that all the 100% of us go to the health centers. And this naturally stretches the resources. Resources in terms of medicine, resources in terms of health workers, resources in terms of nurses and midwives. And then resources in terms of even infrastructure and space.
So what you're saying is that we need to change the culture, because we always believe even if I go to a hospital, I need to get drugs.
Yeah, you see the challenge with Ugandans, or with us, myself inclusive, is that we think that for us to have a lot of medicine is an indicator of a healthy nation. To the contrary, it's not. If you look at all other developed countries, having a lot of medicine is an indicator of actually an aiding nation. And if you look at other developed countries, they really minimize on medicine's intake. That's why you see in other countries, for you to get more than one medicine, you must be guided by a senior consultant at that level. In Uganda, even a clinical officer will prescribe 4 types of medicine. Actually, we have distorted ourselves to the extent that if you go to a health center and the medical person gives you 1 or 2 types of medicine, you think that kind of doctor is a quack. So you will still go out to the private, where they will prescribe for you 20 types of medicine. And no wonder the non-communicable diseases, the collapse of kidneys, collapse of liver, the collapse of many other organs in our body, have increased, because we are failing to manage at the basic point, which is prevention.
All right, so let's talk about prevention, because according to the research findings of the Ministry of Health, and this happened during the launch of the National Fitness Day, they say that 43% of the deaths that are registered on a year-on-year basis here in Uganda are as a result of non-communicable diseases. So it's a big issue that we need to address. But just break it down for us. When you talk about preventive measures and non-communicable diseases, what exactly exactly does that entail?
Of course, the communicable ones are the ones that if I have flu, you'll get it
Right.
now in this room. If, for example, HIV and then you meet and have sexual intercourse, there is a chance or a likelihood of it spreading to you. But there are those that will happen to a human being naturally out of some scientific reason. Say cancer, say high blood pressure, say diabetes, and you may not spread them to another person. You have them, it's you, and your disease, you manage it until such a point. Now, what happens is that most of the developed countries have reduced the communicable diseases to the lowest levels. And that gives them an opportunity to concentrate their resources to non-communicable. And the research and the prevention and raising the levels of technology to managing the non-communicable diseases. Unfortunately for us, both sides of the curve are rising. The communicable is rising and non-communicable is rising.
Right.
And what does that mean? That naturally translates to the first question that you asked me, the medicine stock out. And it doesn't only translate to medicine stock out. It translates to constraining the health sector in terms of service delivery. Because if you are managing one side, then you pull these resources downwards to manage one side. Unfortunately for Uganda, the resources are needed for non-communicable and communicable diseases. If you now go to Cancer Institute, you will be shocked by the numbers. Cancers are going too high, too many types, and this comes with many other challenges that need more money. And remember, these are specialized. If you're treating cancer, everything almost is specialized. If you're treating heart diseases, everything is specialized. So the costs of managing these kinds, the non-communicable diseases is so high. And now that we are getting to that level of having a lot of non-communicable, that naturally means we should fight so hard to reduce on the communicable diseases.
How do we go about fighting? Of course, the conversation has been, like you're saying, it's communicable and non-communicable.
Yes.
And if we just reduce the communicable, then the resources will go towards fighting
Yes.
the numbers, the prevalence rate of the
Exactly.
non-communicable. But how do you even start? For example, if I'm here, you have a cold, I can catch it.
That is one.
So how do you prevent
that's
that?
one in a million. You know, what is disturbing our people and ourselves as a country is that we have failed to adopt to the small concepts and the basic ones at that. I'll tell you, if you will go to a wedding and it will be lunchtime, and out of 100 people, only 5 will wash their hands. But I'll tell you, the 95 who have not washed, in the last 5 minutes have maybe used the toilet, and now they are coming to eat, and they have not washed their hands. Now, that naturally will translate into some disease, either cholera, typhoid, or something else.
Right.
Now, and even in this country, we don't know how to wash hands. You'll find someone washing this finger, and you ask them, what are you doing? They will tell you, I'm washing hands, I'm going for lunch. This finger and this finger. And when they start eating, they'll be using the 5 fingers.
Right.
And with the help of the other 5. Literally meaning that they're transferring all the germs from these 5 fingers and these other 5 fingers, and what they're feeding on is actually. That's one. 2, I would request and urge that we reduce politics in management of healthcare. There are things that we should enforce without question. When you go to Mulago, there's what they call border ward. It's a ward for border victims. And what are they treating? Most of them, when they get border accidents, then they hit their heads first on the ground.
Right.
So they want neuro treatment. And when you're treating a neuro case, first of all, as a country, we do not have very many neuro specialists, either neurophysicians or even neurosurgeons. So if you have few, for example, doctors, neurosurgeons, and neurophysicians, that means you want to concentrate them on those major and critical cases. But you find that they spend most of the time treating border cases. then broken limbs,
Right.
arm, legs. Now, government, I think, should come out with a clear policy on helmets. That if you're in a border, one, you must put on a helmet.
Regardless of whether you're the rider or the passenger.
Or the passenger.
All right.
And if you're found to be in breach, you get your express penalties. Or the law must be put in place on how such a matter should be handled.
So what you're saying is that we need to push for behavioral change.
Majorly.
All right.
Yeah.
And we do have the bites of Madam Ruth Cheng, the Minister of Health, together with the President. They're trying to give us tips on how we can go about preventing some of these diseases. Let's take a look.
Among the non-communicable diseases, the heart diseases account for most, followed by the cancers, respiratory diseases, and lastly, the diabetes. And all of them lead to premature death.
Masava nigazibikira emiswa omuntu nafa ubona afuna ebirwadde birala nga sukali nga pressure ng'omutima n'ekokoro byonna abasawo basitegeezeza nti biva ku ebigambo ebyo bibiri emmere eyitiridde ate gy'otakozesa bulungi.
So lifestyle is also a major issue. The President says that he takes, a heavy meal for his breakfast, something very little during lunch, and maybe something very small in the evening. So our lifestyle, even how we eat, but our culture is different. Actually, when you look at our plates of, food, regardless of whether it's breakfast, lunch, or dinner, the biggest chunk is carbohydrates.
Yes.
We Ugandans love our carbohydrates.
We, first of all, as Ugandans, we love our food.
And we love our food
we
as
even
well.
don't mind. Rarely do we even look at the plate to interpret carbohydrates, proteins, and vitamins or anything.
Right.
We serve to the extent of availability, whether it's morning, lunch, or dinner, which is okay. I would say okay. I don't want to offend anyone. But I think the President's issue is, if we eat that food, we must exercise.
We must burn it.
We must burn it, because if I understood him well, he's saying that we feed our bodies with a lot of food, and then this food, because there is a lot of fat that is not converted into energy because we are not using this food, then now it becomes fat, and then it affects the whole system. So you find yourself developing pressure, diabetes, and the other of the diseases that he enumerated. So I think, and of course this is more to the urban and the people in corporate arrangement our daily schedule is such that you get into the car. I was in the car driving here. From here, I'll get into the car driving to my office. From my office, I'll drive for lunch. From lunch, I'll drive to my home. From home, it's a circle of driving. Your body does not get any opportunity to either exercise or shed off some unnecessary fat. And of course, that's why most of us are bulging. You see, unfortunately, we are a country where we think being massive
It's
it's
healthy.
a sign of money. Unfortunately, it's a sign of getting closer to your grave, because if you consistently put on this weight and you're not shedding it off, naturally something will fall.
Right. Let's talk about the programs that you have. I'm sure now that you're celebrating 25 years, you have quite a number of programs just to sensitize, the public with regards to preventive health care. So break that down for us.
On the 11th, we have a program. We have a meeting with women leaders and youth leaders across the country, women district chairpersons and the youth chairpersons. And we invited them to NMS. We want to sit with them, take them through what we are talking about, prevention, and hear from them what do they think about prevention and how best can we join hands to have a healthy nation. And I think we'll have NTV as well. I think it is supposed to be a live show. Then the next day we're supposed to have religious leaders, and we expect the Archbishop of the Catholic Church, the Archbishop of the Anglican Church, the Mufti, and all the other heads of different lives around. And because our target was that we target people that interact with more people or many people every day in conducting of their daily business. And then they would help us spread the information downwards,
Right.
so that we reach as many Ugandans as possible in trying to fight this issue of non-communicable diseases. Actually, major non-communicable, the diabetes they talked about, the pressure they talked about, and the size, to see someone is really almost bursting
Right.
because of food. And we think we can share with people and teach ourselves on how we can improve on these areas, and also look at the communicable diseases, the washing of hands that we talked about.
Let me ask you a question. Do you think now we need to change how doctors also attend to the patients? Because I'll tell you for sure, my experiences when, for example, I take my children to hospital, of course, you know, children don't wash hands. They don't know even the need of washing hands until you force them to. But I hardly hear the doctors, you know, reiterate the same to the children, telling them, you know what, you're supposed to be washing your hands. You know what, you're supposed to be eating X, Y, Z. Do we need to change how also the doctors or the medical, you know, attendants talk to us? Because most of it will be, you go to the hospital, you get diagnosed by X, you know, kind of disease, and they give you the medicine, but they don't teach you how to prevent the occurrence of the same disease again. So do we need to change that conversation on the part of health attendants?
I entirely agree with you, but it shouldn't actually start with doctors. This is what we should take down the value chain in terms of even of our education system. Because, you know, you cannot claim to have an educated population when they are not healthy. So my view, and that is NMS view, I think now, is that we should go down to even schools and talk to children, so that they grow up knowing these basics.
Right.
So that they even find it, actually, children are the best teachers. If you teach a child and along the way the parent is doing something wrong, the child is, no, daddy or mommy, they told us this is wrong. And of course the parent, deep inside themselves, get embarrassed and they may not repeat it.
Right.
So we should take this down to children in schools, both pre-primary and primary schools, and upper secondary. And then gradually the doctors also should adopt the same method. Unfortunately, currently, the situation as is, like in government health facilities, doctors are overstretched with numbers. So they are seeing one quickly to see another.
So they're rushing to see as many
to
patients
get
as
off the
possible.
load. Yeah, because it is too much.
Right.
The line is too much, and they are counting on time. If they don't do it fast, still people will complain that they have not been attended to. But I would still request our doctors that once in a while, when they get that small time, they can talk to the patient on how best they can prevent diseases.
Right.
And I wanted to bring out some few issues, and one of them is us as Ugandans, we emphasize human rights. It's my right to do ABCD. It's my right to do X. It's my right to eat without washing my hands. It's my right, for example, not to use a condom, for example. It's my right to impregnate my wife every year. But you know, what we forget is that whatever happens in the negative, then they think it's government responsibility.
Right.
We flag our right and forget our responsibility. So I would request Ugandans that let's go back to the basics, but also emphasize, as we emphasize our rights, let's also think about our responsibilities. I'll tell you, if you move on Kampala Road or Entebbe Road, you'll find a dead dog on the road every day. And that dead dog on Entebbe Road will have caused an accident.
Right.
Now, we're asking, what does it take to put up bylaws to kill all the redundant dogs and make sure that people that have dogs domesticate them and they are vaccinated? This country spends close to 600 million every year buying anti-rabies vaccine. And what causes rabies? I mean, these are wild rabid dogs.
Yeah, stray dogs.
Stray dogs and cats. And you're saying, what does it take? Even at the district level, you pass a law or a bylaw and you kill all these stray dogs and you direct people to domesticate their dogs and you vaccinate them.
But the issue has always been not the, you know, execution or putting in place policies, but implementation and enforcement of
And
the
that's what I'm saying. Actually, that's the issue. Because what you need to do, of course, the policies even could be in place.
Right.
We only should be seen, and actually, we should be acting on these policies to make sure that if it's a dog, it has the owner, and this owner must take responsibility of whatever this dog does. So, and the other one goes to family planning. You know, I always tell people, you know, African men, we don't know how to express love. So we think impregnating women everywhere is a way of demonstrating love. But we forget that this woman needs some time to recover when they have given birth. The child they have given birth to needs time to get the mother's love and grow properly. That's why we have many cases of women dying in labor and many children dying before they celebrate their 5th anniversary. And we can only solve this by doing the family planning concept. And when you tell people that family planning, they think you're stopping them from giving birth. But our point is, give birth to as many children as you want, but space them.
Okay.
Because if you space them, then the woman will recover, then they will have enough time with their kid, and then, by the time they come back to give birth to another child, they will be strong enough.
So that actually explains why your focus, as you celebrated 25 years, your focus is on having these crucial meetings with the influential leaders in society to pass this information to their followers. Okay, thank you so much. As we come to a close, you have 1 minute to give us your last remarks. My last remark is what I started with. I beg of you Ugandans that we go back and do the basics. Wash our hands, put on the safety belt. Right. We even call it a seat belt because we want to downplay the road. And put on helmets. And do the other small things that would keep us healthy instead of running to health centers for medicine and medical supplies. Because the print of medicine and medical supplies does not demonstrate a healthy nation. It actually demonstrates an ailing nation. Okay. Thank you so much, Mr. Dan Kimosho, the Principal Public Relations Officer at NMS. And NMS is the National Medical Stores. That has been it for Kickstarter. Morning at NTV still continues. Up next is Andrew Chamagero with Reality on the Ground. Keep it here.